We move on to the next presentation for today, and we have an esteemed personality, Dr. Anish Behl, for the next talk today. Dr. Anish has done his MD in General Medicine and DM Endocrinology. He's a consultant endocrinologist at the Apollo Sugar PGS Hospitals, Mysore. He's also studying his services to the Wellness Super Specialty Center, Mysore, and his specialties lie in autoimmune thyroid diseases and type 1 diabetes. So, Dr. Anish, over to you, and we are eager to listen to your presentation. Thank you.
Just let me start by sharing my slides.
This presentation on the non-pharmacological intervention in diabetes, and that would be very interesting and very happy to listen.
Thank you, Dr. Modi. Let me start by wishing everybody a very good afternoon. I'd also like to thank Dr. Vishali for this invitation. We have had a really comprehensive talk on the newer molecules that are available or are going to be available in near future for management of diabetes, something which is very, very interesting. Now, we move on to the next part of management of diabetes, what is called the non-pharmacological intervention. I mean, we as practitioners, diabetologists, endocrinologists, pay a lot of stress to medications, right? Pharmacotherapy, whether it's injectables or oral drugs. And a lot of us in our busy practice probably fail to understand the importance of the non-pharmacological interventions. So what I thought is like, I mean, rather than restricting myself to the last 1 year, I thought, let me just go a little more deeper. So I have listed out a lot of studies which have looked into various interventions and which have had a very positive effect in this direction. So what I thought was that, we will start from something which is very basic, something about talking to patient, about educating about patient. So for the next 20 minutes, I'm going to first talk about studies which are available with regard to diabetes education, what's called DSME, diabetes self-management education. One particular aspect of management, which most of us don't pay too much of attention to. There are very few of us who sit and talk to a patient, try to explain to them that why he or she should pay so much of attention to diabetes, why food control is important, why regular exercise is important, why taking medicines are important, why you need to get tests done, why you need to meet doctor, and things like that. So this is one aspect which I thought, let's start with the very basics. Then we'll move on to MNT. Again, most of us do talk to our patients about this, but probably what we need is a more comprehensive approach, exercise. And then I'm going to talk about certain mind-body interventions which are showing a lot of promise in the field of diabetes, yoga, tai chi, and other interventions which I'm going to do. So it's going to be a brief overview of all these things, because obviously in 20 minutes time to look at all these things in depth is going to be a little difficult, but let's see how things work out. Now, let's start with the basics, diabetes self-management education. Now, as I said, this is one aspect which probably we don't pay too much of attention, because we casually tell patients, okay, your sugars are high, you need to start these medicines, follow a diet, follow an exercise, and things like that. But if you have a comprehensive diabetes education program, if you have, now for most of us, probably it may not be possible to sit and talk to our patients regarding diabetes education in a comprehensive manner. If you have a dedicated nurse educators, dedicated dietitians who can play the role of nurse educators, then yes, you can have some kind of a schedule in your clinic where each new patient is educated about this thing, and then every visit some kind of aspects are talked about. Now, what has been seen is that with diabetes education, you can improve the knowledge of the patient about diabetes, and you can improve the self-care behavior. If a patient who's empowered, who's knowledgeable, probably is going to take more care of himself, and over a period of time, it becomes easier to manage these patients. It definitely helps in lower HbA1c. I'll show you those studies which are available. There are a lot of meta-analysis which are available in this particular aspect. Improves quality of life, and a knowledgeable patient who takes care of himself would ultimately end up reducing the healthcare cost. Now, that's very important in a country like ours, because we are a country which has huge amount of burden of diabetes, huge amount of financial resource crunch, and somebody who takes care of himself, uses the healthcare facilities less for acute care, would definitely help in a long way. So this is one study which is a meta-analysis which looked at about 21 studies, including about 3,000 odd patients. Well, what I wanted to concentrate on is that the reduction in HbA1c they found out with just group-based self-management education. You can see at 0.44 at the end of 6 months and 12 months, and the end of 2 years, a very robust 0.87% decrease in HbA1c levels. So just educating patient, empowering patient can make such meaningful reduction in HbA1c levels, which is really very surprising. There's another study, a huge study. It's a systemic review, included close to 11,000 patients in intervention group and another 11,000 in the control group, close to 118 DSME interventions. Now, what they found out in this particular review is that overall, if you look at the whole population, the reduction in HbA1c was very robust, 0.57%. And when you look at the modes of DSME, when they talk about the combination mode where the combination of individual and group education was used, the reduction of HbA1c was very comprehensive, very robust, 0.88. And surprisingly, or probably as expected, more the number of contact hours with the educator, more was the reduction in HbA1c levels. So probably in Indian context, where a lot of doctors don't have human resources in form of nurses, nurse educators or dietitians, what we can do at our level is maybe at every visit the patient comes to us, we can just ask brief questions regarding whether the patient is following regular exercise schedule, whether the patient is eating properly or not. And over a period of time, patient tends to realize that the doctor is just not looking at my reports, just not looking at my medications. He's also trying to address certain aspects which he or she may not be paying so much importance to, and that probably would help, help the patient in a long way. Now, moving on to the second intervention, that is medical nutrition therapy. Now, this is something which all of us are aware of. Nutrition therapy plays a very important role. It's an integral role in management of diabetes overall. But for most patients, the most challenging aspect is to determine what to eat. All of you would agree that even patients who've been diabetic for 15, 20 years, when they come to your clinic or to your consultation room, most of them tend to ask this question, sir, can I eat this? Can I eat that? Can you just tell me what should I eat? So it's something which is very surprising that somebody's been diabetic for so many years, is trying to follow some form of diet schedule, but they still have so much of doubts about the whole thing. What is important to understand is that in diabetes, there is no one size that fits all. Every patient needs to be given an individualized diet plan. And it's very important that when a patient gets diagnosed with diabetes or has diabetes in the early phase, probably somebody needs to sit with them. If you have a dedicated nutritionist, they should sit with them, clear the doubts regarding nutrition, regarding whatever misconceptions they have about diet, give them a proper individualized diet plan so that they try to follow it, and that would go a long way in managing diabetes. I'll just show you some data that how medical nutrition can play a very significant role in improving various parameters. Now, this is a systemic review done by the Academy of Nutrition. Now, I just taken certain aspects of it. When you look at the impact that MNT has on glycemia, and you look at HbA1c levels, at the end of 3 months, there was a reduction of HbA1c from anywhere from 0.3 to up to 2%. Now, 2% reduction is very, very robust, very, very comprehensive. And what was found out is that this particular decrease in HbA1c was maintained or even improved at the end of 12 months. That means the patient continues to be following up whatever instructions are being given by the dietitian, or there is reinforcement of MNT on each visit. The HbA1c level, which decreases initially, is maintained even beyond 12 months. And same is true even for fasting blood glucose levels, which came down by about 60 milligrams at the end of 3 months, and this persisted beyond 12 months. Even when you talk about cardiovascular risk factor profile modification, there's a little mixed kind of results where there's most studies did show improvement in total cholesterol, LDL cholesterol, improvement in HDL cholesterol, reduction in triglycerides and blood pressure. But it was not like all studies showed them. Majority of studies showed a positive effect. Some of the other studies were neutral. Nevertheless, that particular trend was there towards positive effect. Even when you talk in terms of weight management, there was a statistically significant 2.5 to up to 6 kilos weight loss in at least 11 out of 18 studies, and just with a proper advice regarding what to eat, what not to eat. So what we can see from this particular systemic review is that MNT does play an important role. Now, there's very interesting study which came out just recently, 2022, wherein they looked at the potential for registered dietitians to alter the healthy behavior interventions, how it can make an impact in a diabetic's life. What they found out is when it came to blood glucose reduction or HbA1c reduction, there's a very, very high certainty that if a nutritionist intervenes, talks to the patient, you can expect a reduction in HbA1c levels. Similarly, when it came to improvement in body composition, improvement in weight, cardiometabolic risk factor profile, there's a moderate degree of certainty that a good nutrition counseling can make a positive impact. Other aspects, the effect was plus and minus. So what we can summarize from at least these two studies, and most of the studies are on the same line, that MNT can make a significant impact as far as reduction of HbA1c is concerned, as far as reduction of weight is concerned, as far as alteration of cardiometabolic risk factor profile is concerned. And this is one aspect which we as clinicians probably should stress, because again, in our busy OPDs, we tend to kind of sideline MNT, we pay more stress to drugs. And you can see here, the reduction in HbA1c level is probably as good as a lot of oral drugs. The third aspect is exercise. Again, when you use the word physical activity, exercise, many times you use them interchangeably. There's a subtle difference between the two. Essentially, physical activity includes all kinds of movements where you end up doing energy use or energy expenditure. When you do it in a structured and planned manner, that's what's called exercise. And exercise has lots of benefits in diabetics in terms of reduction in blood glucose levels, improvement of cardiovascular risk factor profile, contributes to weight loss, gives a sense of well-being to a lot of patients. In a pre-diabetic, you can prevent or delay the onset of diabetes. In somebody who's in the early phase of diabetic, recently diagnosed, you can also cause the diabetes to go in remission. So a lot of benefits of exercise, again, a neglected aspect as far as patients are concerned, because all of us have encountered various reasons that the patients give for not exercising regularly, the reasons why they not been following an exercise schedule. What we as doctors can do is probably just stress the need for exercise. I'll just show you some data to show you how exercise can have a meaningful impact as far as blood sugar reduction is concerned. So this is, again, a systemic review. This is a little old one, but nevertheless, it's still relevant. You can see here a structured exercise training program can reduce HbA1c by 0.67. This is a fairly large study, 8,500 patients. And when you talk about aerobic exercise, 0.73, you talk about structured resistance training exercise, again 0.7%, and somebody who's combining both, again 0.51. So a fairly good reduction in HbA1c levels with just a regular exercise protocol, whether it's resistance training, whether it's aerobic exercise, the benefit is seen across the board. Now let's look at some of the other interventions which are showing a lot of promise in diabetics. A lot of studies are coming in over the last few years showing a positive impact of these interventions in patients with diabetes. For that matter, any lifestyle disease, be hypertension, obesity, dyslipidemia, all these aspects are positively affected by yoga and other certain mind-body interventions. Now, this benefit of yoga has been found in a lot of recent reviews. It's a known fact that a lot of our patients do use complementary or alternate medicine practices, and yoga is by far the most popular amongst this. A lot of our patients follow yoga along with whatever we tell them to do, MNT, exercise, medications, etc. And it's a fairly popular form of, I would say, intervention in a lot of Indian patients. I'll just show you some studies which have looked at the positive effect of yoga on various aspects. Now, this is a recent systemic review and meta-analysis which came out last year itself. You can see here, this is a forest plot which shows that there was a significant reduction in HbA1c levels in the group which was following yoga regularly versus the control population. And the same was even true when it came to fasting blood glucose benefit in the yoga group versus the control group, and the postprandial sugars. Yoga group fared better compared to the control group. So there was overall a comprehensive reduction in fastings, postprandials, and HbA1c levels in those group of patients who were following yoga regularly. And there's another study which is a little older study, but the same kind of trend you can see. There is a reduction in HbA1c levels, there is a reduction in fasting blood glucose levels, and this is of the same order as was seen in the previous study. Now, there's another very interesting study which came out 3-4 years back. Now, this study is a little different from the other systemic review. Now, in the previous two meta-analysis which I showed you, one group was the yoga group, the other group was a control group where probably no interventions there. Now, this is a systemic review which looked at two active groups, one which followed yoga, other which followed physical exercise. And surprisingly, you can see here that the yoga group had a better control of fasting blood glucose, 15 milligrams better, 28 milligrams better postprandial reduction, and HbA1c came down by about 0.39%. Though numerically these figures are not big, but statistically there was a difference. So we are talking about two active interventions, yoga versus physical exercise, and this particular review, which had a fairly good number of patients, 1800 odd patients, showed that yoga had that little edge over physical exercise, at least from this particular paper. So moving on to another form of mind-body intervention, that is Tai Chi. This is a form of mind-body practice which originated from China. I mean, it's a form of a martial art, but what is being done now is like a low-impact, slow-motion kind of an exercise, wherein you continuously keep doing series of slow-motion exercises or motions without a pause. And a lot of positive reviews are coming out with regard to Tai Chi. Now, this is one paper which came out in 2018. Again, they found out that compared to the non-exercise group, that means a control group which was not doing any form of exercise, there was a reduction in HbA1c levels in the Tai Chi group. Similarly, they also compared Tai Chi with other group which was following some form of aerobic exercise. Surprisingly, they found that Tai Chi was better than the aerobic exercise. Now, the same group of authors had done a meta-analysis about 10 years back in 2011. And that meta-analysis did not find benefit of Tai Chi over the conventional form of exercise. Probably at that point of time, there are not too many studies which are available, but over the last 1 decade, lots of new studies have come in showing benefits. And that's the reason why this particular meta-analysis shows a significant improvement in various parameters. There's another systemic review which was published recently, which looked at the impact of Tai Chi on BMI, quality of life parameters. You can see here that Tai Chi versus the control population or Tai Chi versus the other exercise population, there was benefit in both these category. I mean, compared to both these category of patients, Tai Chi fared better. And the same was even true for waist hip ratio. Whether you're comparing Tai Chi with a group which was not doing anything or just a plain control group versus a group which was involved in some other form of exercise, the reduction in both BMI and waist hip ratio was more substantial in the Tai Chi group. They also looked at quality of life parameters. They looked at a measure called the SF36, which explores 8 different domains. And I just listed 2 of them. And they found that the benefit of Tai Chi as far as quality of life parameter was seen in all these domains. Just listed 2 of them to just show you that it was statistically a significant difference. So that was about the new, I mean, I would not say new, old form of a mind-body practice, which is showing a lot of rejuvenated interest in it. There's this study, which was a systemic review and meta-analysis published just last month, which looked at various mind-body practices and looked at the impact of these mind-body practices on glycemic control. There are 28 studies which were included in this particular meta-analysis. Now, what you can see here is that overall, they found out that whatever MBM practices patient was following or whatever MBM interventions were there, there's a significant 0.84% reduction in HbA1c levels. This is pretty good if you really look at it. And when you look at various subsets, like, for example, mindfulness-based stress reduction, that also reduced HbA1c by 0.48%. That is a significant reduction, statistically significant. Qigong, 0.66%. Yoga, 1%. So this is a review which came out just last month. 1% reduction in HbA1c levels, but just with yoga. And what was very interesting is when they did a meta-evaluation, they found out that for every additional day of yoga per week that the patient follows or involves himself in, there is a further reduction in HbA1c levels. And this benefit is also seen in the fasting blood glucose with whatever mind-body practices the patient was following. So essentially, what this paper shows is that the mind-body interventions that we are looking at, which are commonly being followed by patients, do have a positive impact. And this is something which probably needs to be explored further. So I would like to just conclude by saying that non-pharmacology interventions have a very important role to play in management of diabetes. This is something all of us know, all clinicians know, but probably we don't pay enough attention to this aspect of management of diabetes, obviously because of our, I would say, because of time constraints that most of us have. The basics of non-pharmacological intervention, like educating patient, talking about nutrition, talking about the importance of exercise, all have been shown to have a beneficial effect in terms of reduction in HbA1c levels and also in terms of improvement of other parameters like weight and cardiovascular risk profile. In fact, the degree of benefit in terms of HbA1c reduction with these measures is comparable to some of the classes of oral anti-diabetics. 0.5 to 0.7% reduction that's seen with some of these measures is as good as the reduction seen with, let's say, AGI or gliptins. So this is definitely something which probably we should not neglect or overlook. When we talk about the NBM practices, there's a huge body of evidence that is, I would say, accumulating, which shows positive effects in diabetes. Probably what we need is a large, dedicated prospective study, more of a randomized control study rather than meta-analysis, because a lot of us have certain, I would say, issues with the way some of these meta-analyses have been done. But if you have a large, dedicated RCT, prospective RCT, which looks at some of these interventions and shows that they have benefits, it will give confidence to most of us to prescribe these interventions in a more comprehensive manner. So with that, I come to the end of my talk. Thanks a lot for patient hearing. I'd just stop sharing my slides.
Thank you, Dr. Anish. That was a very difficult topic covered very scientifically and in a very simplified manner. Just one or two comments can if I'm allowed to make. Actually, a lot of guidelines, there are some 47 guidelines there in diabetes. We all talk of the first thing is LSM, lifestyle management. But like you said, the reality is hardly we give any time and effort to that. We directly jump to pharmacological intervention. And there is a lot of data which says that these measures go hand in hand and go much more. The only comment I wanted to make is there has been a lot of talk about good communication through scientific methods like SMS communication. ADA had published a paper from Bangladesh. They found a good reduction. The Livongo study, which was presented in 1996 in ADA, that shows a 26 milligram reduction in fasting and an HbA1c drop of 1 gram by just a glucometer recording being communicated through SMSs or through the app. And I have two papers of my own. One is just getting published by Peter Fry, which showed me and Dr. Tevaskar and all of us that just doing a CGM, effective CGM, which I call it empowering the patient. See the CGM, they themselves manage their lifestyles much better than the amount of counselings we can do. It's sort of a rhetoric for them. They start managing it. So a lot of these measures make a lot of difference without increasing the therapeutic bulk. Even in exercise, it's not aerobics which is important. It is a resistance training. It gets sugar down much better. It's better for the heart and the muscles rather than just burn calories through aerobics. There's enough data to show that resistance training plays a bigger role. And that is why gym training is not very effective. But training under a supervised physiotherapist is more effective. In fact, a lot of gym trainers are dying prematurely, as we are aware in what we read in the news. So that the wrong concept is there through many apps and all. And the only comment I would like to make is this lifestyle measure are being followed by patients through apps, through various non-medical portals, and they charge a lot of money and they give a lot of glamorous attitude, this management without official good results, Where medical parlance is not very active here. So like you said, if we incorporate these measures in our practice on an equal footing, like pharmacology, maybe it will give a better care to a diabetic population. Because most patients are going to non-qualified people and learning these things in a very unscientific manner.
I think I think I agree with the last part which you said, that we doctors are not paying enough attention to these important aspects of diabetes management. That's the reason they are collecting information from other non-scientific sources. In fact, you would not believe it, without naming anybody, there's one particular, dietitian in Bangalore who's doing CGM in a huge way. I'm sure she does more CGMs than most doctors do put together. And she charges a bomb. I mean, you cannot believe the amount they'll charge for it. And she is doing it even for patients who are non-diabetic, who just want to go on a weight reduction schedule. So in things which have been done in a very non-scientific manner, but because they're all done in such a nice manner, the looks are so good that most patients tend to get attracted and they go for it. What you said
And
is
if you know one
absolutely
app
true.
which flashes on Facebook and YouTube, the moment you open a YouTube, I won't name the app. Everybody is announcing it. I mean, every 5 minutes that app runs. Something which begins with H. And they use CGMs left, right, and center. And I mean, people are losing 30 kilos and 35 kilos. I mean, mind-boggling. I don't know if it's true. But
We have actually analyzed the data from our diabetic patients as to how many are using methodologies beyond the modern medicine that we are prescribing. And the analysis has just been completed last week. And to my surprise, 85% of our diabetic patients are using things beyond our medicines. They are using our medicines. That is definitely there. But beyond that, they are following either yoga, they are following Ayurvedic, they are following herbal medicine, they are following the apps, so many devices. And it was an eye-opener to me that we fall short for explaining our patients the scientific methodologies to do these things. And I think Anish has done a fantastic job of converting this whole non-pharmacological intervention data into a scientific literature that has been collated together. And I think this is what we as people of science need to know, that people go to others because we are insufficient in that aspect. So I think one of the aims of doing these conferences that we should improve our sufficiency on providing the right information rather than allowing or rather blaming patients and blaming dietitians and whoever for doing wrong jobs. I think we need to know our jobs better. That is what Anish has very well pointed out. And I'm so glad that and he's been very proactive in deciding the program also. So Dr. Anish and Dr. Aarti has been the key people to help me design such a wonderful program. And I think he's aptly covered the topic where all doctors need to actually pay attention to the non-pharmacologic strategies so that we don't lose our patients to quacks. So that is very important.
I agree.
there was one slide I was quite amazed. Tai Chi has a p-value less than 0.00001. I mean, amazing, huh?
Absolutely.
Very eye-opening. Thank you for the wonderful talk and a presentation. It was an honor to listen to you.